Thanks, Andrew, and thanks everyone for attending. I want to first apologize in advance if you happen to see any strange error boxes popping up. I'll do my best to get rid of those in a timely fashion. I'm having some strange computer experiences today. With that said, we gave a very similar presentation at the ExamSoft annual conference this past June and received very positive feedback, so we wanted to share in another venue to reach more institutions who might benefit by this assessment practice. I'm trying to advance here, bear with me. All right, here we go. Please keep in mind the examples that we'll share relate to practicals in a medical school environment, but if you're from another discipline, this can be applied to any practical evaluation scenario where direct observation of student performance is needed. Here's what we'd like to cover today. First off, we do like to do polling during these webinars. Since we can't see or hear you, it helps us better connect with you in an interactive way. So I think we'll have 2 polling questions today. I'll be providing you with a brief overview of our school. We'll provide a bit of a framework in which we've built our written and practical evaluations in ExamSoft during the course of our Year 1 and 2 curriculum for medical students. We'll also allude to how we have cultivated an assessment culture in this process, and from there Dr. Zahl will take us through the multiple grade or rubric for practical exams more specifically, and she'll provide some recommendations based on what we've learned thus far along our journey, and then we'll open up the floor for questions. So without further ado, Andrew, can you help us to launch the first polling question?
Yes, it should be out right now.
Okay, so we're interested in ascertaining the discipline in which you are or will be utilizing ExamSoft for.
The votes are coming in now. We have about 65% of the people have voted. And it's looking like right now pharmacy is at 38%, dental is at 7%, and nursing at 22%, with others sitting at 33%.
Okay, so a pretty good balance of a few of those disciplines. And then we'd also like to understand in our second polling question how your institution is using or will be using ExamSoft. And certainly these are not mutually exclusive, so feel free to check all that apply.
Okay, we have about 63% of the vote in right now, and it's looking like tracking student lead, or student learning outcomes, sorry, is ahead with 92% of the vote, followed by rubrics at 84%, and then reporting is tied with building test bank at 77%, followed up by curriculum mapping.
Okay, fantastic. Well, I think we're going to be able to hit on each of these things. I think all of us have the intention of building a test bank. I just wanted to understand. I know that different schools are using ExamSoft for different purposes, but I think certainly we hope to contribute to each one of these areas in this presentation, and hopefully that'll be helpful to you. So a little bit about Marian University. We are a small private institution located in the heart of Indianapolis. We're the first medical school to open in Indiana in over 100 years, and we are the first Catholic college of osteopathic medicine. We offer a competency-based curricular design focused primarily on the National Board of Osteopathic Medical Examiners, that's MBOME, as fundamental osteopathic medical competencies. That's kind of our scaffolding. We're a systems-based integrated curriculum, so each course is currently run by one course director, and the content is delivered by our full-time faculty and or external clinicians. In terms of integration, if we are, for example, running the cardiovascular course, we will in concert introduce concepts in the Intro to Clinical Medicine and the Osteopathic Philosophy and Principles courses that also focus on the cardiovascular system. So for example, if we run a simulation or an objective structured clinical eval, or OSCE, the scenario will have a cardiovascular focus, for example, patients presenting with COPD, pneumonia, and that sort of thing. We are an iPad exclusive school, meaning that all incoming medical students are furnished with an iPad containing library resources, apps to connect them with our learning management system, textbooks, soft test M, of course, for exams, etc. And all exams are taken using the iPad. For practical exams, where faculty, standardized patients, or peers will evaluate a student, an iPad or computer is used by the evaluator to grade. We continually work to build a culture of assessment amongst our faculty and students, and this is primarily accomplished by the ongoing collection and dissemination of this student performance data. If you've heard any of our presentations, most specifically at the Assessment Institute, we've coined this catch and release, and we talk about letting the data do the work. That's really been very effective in terms of students and faculty becoming invested in this culture of assessment. So as I mentioned, we're engaged in competency-based tracking of student performance. We're able to do this using ExamSoft to categorize or tag test items as well as rubric dimensions or criteria. We track to the standard Bloom's taxonomy in a compressed format. I think a lot of schools are doing this now. So we've got the knowledge, application, and synthesis, as well as the affective and psychomotor domains as shown here. Using our tagging structure, we also track to COMLEX Blueprint. That's our licensure exam. We track to level 1. There's 3 levels. Because level 1, students must sit for level 1 after they have completed year 2 prior to engaging in their clinical clerkship. So that's important for us to be looking at that. We also track to systems, disciplines, as well as course-specific outcomes. The course-specific outcomes are developed by each course director as it relates to their syllabus. In terms of building our culture at the onset, this was an inclusive process. So our assessment office did not send down what the structure would look like. We partnered with faculty to build it, and we review it with them annually for quality assurance purposes, and this has been very effective. So again, just a snapshot of that National Board of Osteopathic Medical Examiners competencies that I mentioned before. This is a snippet of what they look like at a very high level, as well as the COMLEX Blueprint Level 1, just to give you an example of how we're tracking. The MBOME comps actually provide quite an outcomes drill down, and we're actually tagging to that granularity right now. But we wanted to just provide you a framework in which to discuss our use of rubrics for practical exams before we delved in. Clearly, if you're in a pharmacy or nursing discipline, you may not relate to this, but I know in pharmacy that obviously the ACPE standards have quite a few appendices with outcomes in there, so that would perhaps take the place of what we're doing here with MBOME. There you have it. I'd like to introduce you to my colleague, Dr. Sarah Zahl, at this time, and she's going to take you through our practical exam process in more detail.
Okay, so I'm going to begin by talking to you about how we use rubrics in our curriculum, and then I will specifically show you examples of each of these. These are the ways that we use rubrics in our curriculum. Since we are an osteopathic medical school, we do quite a bit of practicals in our OMM lab, our osteopathic manipulative medicine lab. We also use rubrics for our simulations. So in this case, students are working with standardized patients that come in, and they will be doing sort of a mock medical examination with these standardized patients, and we use rubrics to measure their interaction in different ways with those patients. Our OSCEs are objective structured clinical examinations, so many of you might be familiar with that as a format of assessment. We use rubrics at multiple levels within those examinations, which I'll cover in just a moment. And we also use rubrics in ExamSoft for our small group evaluations. In our Intro to Clinical Medicine courses, students often work in small groups in order for us to assess how they interact with each other, how they discuss patient care in groups, because we want to mimic what they'll be doing in practice when they are working in patient care teams. The example that you'll see here is an example of our small group evaluation. I know it's difficult to read what's actually in each box for our criteria, but the important piece to note here is what you'll see in the categories. What you're seeing there as blue font, that is how we tag each of these dimensions to our NBOME competencies that we just described. So each level of this is tagged to a dimension within those competencies. So you could use this tagging feature in many different ways to tag any learning outcomes that you're interested in measuring within your practical assessments. So this is one way that we are using that and tagging our categories to those specific dimensions so that we can track over time how students are doing on an individual level as well as a class level in regards to things like communication skills, responsibility, group leadership, etc. So this is a great way to measure those components and then do some tracking over time so that we can see how students are performing in this regard. Just to show you how we design our small group evaluations, what you're seeing here in the top left, this is what a user would see when entering ExamSoft. I know some of you indicated in the poll that you're already using rubrics, but if you aren't using them for multiple graders at this point, the difference here would be this button here to select the graders that you want to assign, because we're not pushing these assessments out just to individual graders that the system identifies. We're actually grouping our students and assigning faculty graders based on those groupings. So this side of what you'll see is how we actually identify which faculty member or grader is assigned to a specific group of students. So we will go into the system and indicate here which students are assigned to each grader. So that's an important element of this. Instead of one grader per exam taker, this is how we would assign actually multiple graders to each student for a given assessment. And then what you're seeing here in the bottom, this would be our statistics so that we can see exactly who our faculty graders have completed. So this is our progress window. And then this would be their average score. So this comes into play a lot if we're looking at statistics across graders and we want to know how consistent we are, and looking at some inter-rater reliability statistics right after an exam, which has been a huge benefit of this process. Some things we've learned from this, again focusing on this small group evaluation process, but this really applies to any practical assessment if you're using multiple grader rubrics. It's really important for us to complete our planning process external to ExamSoft. So we actually do our groupings, our faculty grader assignments, any logistics that is actually housed outside of the system so that we have that as a reference point as we're building these assessments. Faculty graders and students are pre-assigned, so in our case this is not random. We're specifically assigning faculty members to given groups of students, and then we rotate that so that students aren't always with the same grader in these types of practical settings or in OSCEs, etc. We also structure our exams so that our practical assessments are based on a given body region when we are in labs. So that's important for us to pre-assign in advance as well. And we want to make sure that that again is identified outside of the system before we start this planning process. And then also there's quite a bit of a learning curve with this for our graders. So any extra materials, guides, screenshots, manuals, things like that that we can provide to our graders, we always send those in advance via email and then bring some printouts as well, so that our faculty can understand exactly what they'll be doing and get them used to this process over time. And then communication is huge, of course. for any of these processes or any of these assessments. And it's, of course, important for us to communicate with faculty and make sure everyone's on the same page for assessments. The next way that we use our rubrics in ExamSoft is for our OSCEs, our clinical examinations. This one has 4 components, so we're using 4 sets of rubrics within these assessments. There's a humanistic rubric, which really is a standard rubric that we apply to any OSCE that covers things like empathy with patients, communication with patients, all of those things that we are intending to measure as far as their interaction with that standardized patient. Our students also have to write SOAP notes post any encounter with a patient. So this tells us their assessment of a patient, their plan with a patient's report of an issue, and then their assessment of an issue from their perspective as a student doctor. So those notes, we actually have them submit as well and use ExamSoft rubrics in order to grade those notes post-OSCE. Our standardized patients also evaluate our students within ExamSoft. So they are actually logging into ExamSoft. We've actually created room accounts for them so that we don't have multiple individuals with ExamSoft grader accounts. We have created room accounts based on each simulation room in our simulation center. So we have made it as easy as possible for them to log in just with the room that they're in and use a password that we've given them to grade students on multiple things within a checklist. And then the self-assessment mirrors the standardized patient evaluation. So we want students to actually assess themselves post-assessment and tell us what they could improve upon or what they did really well. What you're seeing here on the screen is actually just a checklist, and I wanted to show this as an example because it looks quite different from our small group rubric. This is actually more of a checklist than it is a rubric, but we've been able to put that format into ExamSoft as well. So if you are operating under sort of a checklist system rather than what we would consider a standard rubric, you can make that fit into ExamSoft as well. So this is what the standardized patients use to go through each of those rows or dimensions and indicate if a student performed this correctly, partially, or if a student didn't do it at all. So you can modify any checklist to fit into this rubric format also. So since we've shown you a couple of examples of how we're using practicals, I wanted to tell you a little bit of a story about how we started with our lab practicals and where we've come, so that we can give you an example of how you can actually modify your process or your culture in order to make this work and to roll this out. I know this looks a little bit complex, but what you're seeing here in this diagram, blue would be our old process and the way that our students used to rotate in a practical examination, and then red indicates our simplified current process. So when we started this process 2 years ago, we were completely paper-based as far as our practicals. Of course, it was very tedious, very time-consuming to aggregate that data and report that data to students. And it also took our faculty graders quite a bit of time to get that information and pull all those pieces together into, at that time we were using an Excel spreadsheet to report grades. So when we initially piloted this process through ExamSoft, we were using what you're seeing here in blue. So in that process there were multiple stations, so each purple indication in that rectangle, those are how our tables are set up in our lab. And each grader did stay at the table, but what happened in our old process is student A1 and student A2 would go to table 1 and grader 1. They would flip and assess each other. So that's why you're seeing that reciprocal arrow there. They would then move to a next grader, and then student pair B1 and B2 would rotate up. And so we did this continual process, and students were assessed on multiple body regions, and they actually were assessed by multiple graders and different students at each station. Now what we've simplified here is really just 2 students at one station. They do flip and work on each other as partners, but we have now assigned just one body region. It's predetermined, but it's a surprise to the student. So when I was talking about those groupings on a previous slide, that becomes essential here as well, because that will need to be pre-assigned before students actually come in the room. But it has actually simplified our grading process within ExamSoft quite a bit. So this just serves as an example of how you can tailor a very complex process to really make it work within ExamSoft, and how we have structured our practicals to make it as simple as possible for both our students and our graders. So really the outcomes of this process have been pretty exciting for us. We've actually received a lot of positive feedback about this change and the implementation of the multiple grader rubrics. Really modifying that structure, particularly as I showed in the previous slide, that has been quite a culture shift. We received a lot of positive feedback about the ease of use from our graders, as well as how quickly we can actually return results to students. It's greatly improved that process. It used to take a couple of months, honestly, to aggregate all that data from paper and then return that data to students. And now I can show faculty those inter-rater statistics immediately post-exam, and then students are getting their rubric data returned to them within a few days, which is pretty exciting for us as well as our graders. They're very excited about that. We also use the categories that we previously described, and we pull that category data from our practical and our rubrics and compare that to written exam data. So we can then track student performance trends over time in any report that we would like, any category, any competency, any learning outcome. We can look at that data side by side and determine if students might be struggling in more of a practical type assessment versus written. That then allows us to identify how we can work with a student to improve in a given area. This has really been a continuous process. We are still continuing to refine what we're doing. So this isn't a quick solution that can be added to a curriculum. This is really something that has to be a continuous refinement process over time, and really collaborating with the course directors and faculty in those courses that have a clinical or a practical element to continuously improve this process and make it work the best we can for our students and for our faculty. So before we open this up for questions, we really just want to leave you with a couple of thoughts as you're starting to ask questions or add information in the chat area for discussion. Just thinking about how you're currently assessing student performance. And when we say practical settings, I think it's important to also say that this isn't just something in medicine or pharmacy or dental. You can really look at this from the perspective of any observable behavior in your students. So that might be student teaching, it might be internship assessment, however you're currently doing that in a practical setting. So thinking about that, and then thinking about how you might be able to incorporate this into your curriculum. So feel free to ask us questions as you think about those two thoughts, and we're willing to answer any questions that you have or provide suggestions or feedback, and we're always willing to collaborate if you have any questions as well.
Thank you very much, Dr. Zahl and Dr. Jimenez. We'll now open up the floor for questions. If you have questions that you want to ask, on the right-hand side of your screen, you can post your questions in the little question box down there, and we'll go down the line right now. So starting off, how do you determine criteria to be used to assess student work?
That is really in collaboration with faculty. We use those categories that we've shown in the presentation to design our whole curriculum. So within those categories, we work with faculty members to design any assessments that they would like to design that adhere to those measures. And so we can then pull that data and that student performance data over time so that we can look at how students are performing in multiple areas of the curriculum. So that's really a collaboration effort with faculty. Our curriculum is designed in such a way that we have course directors and then we have multiple faculty within each course. And so those faculty collaborate, and then we then collaborate with that group of individuals in order to collaborate and design assessments that can then be tracked over time.
Thank you very much. We'll move on to the next one. How do you handle last-minute changes in faculty, such as like no-shows or subs?
Do you mean, if the question is about how to reassign a faculty grader in the system, I believe there has been a recent change, or it's under development, to be able to change that assignment within ExamSoft. So currently and previously in the practical assessment area and assigning multiple graders, you could not change that, and that was a limitation from my perspective. But my understanding is that is currently undergoing change in the system so that you can, at the last minute or whenever something changes, you can change that assignment within the system so that that student is reassigned to another grader. What we've done as a workaround in the system, there are two things we've done. One is to use those room grader accounts that I described. So let's say when we're in our simulation center and we are having any grader that's assigned to simulation room 1 log in with the same grader account. So then students are not linked to a specific faculty member in that setting, but they're linked to a room. So if someone had to leave at the last minute, or if an emergency would arise, that grader account would still hold true for those students that are in there. The other thing we've done, if someone does say they need to leave at the last minute or something needs to change, we have unfortunately had another person just hand off, since we're iPad based, switch over to that other grader. That's only happened 1 or 2 times. The best workaround that we have come up with is that room grader account, so that it's a standard login and a standard password.
Thank you very much. So the next question is, do you use LDAP authentication for your users? If so, how did you handle the room sign-in for standard patients?
We do use LDAP, but what we've done with the simulation rooms is we have created email accounts, and those were just Google accounts, and the emails were then used to log in. So we were able to work around the LDAP authentication with those accounts, working with our IT.
Thank you. The next question I have here is, what was your process from turning a checklist into a rubric format?
That was a collaborative process with faculty. And that has been part of our process from the beginning, is how can we modify what we're already doing in order to make this fit within the system. And what we did in that regard is we took a basic, essentially when we started it was basically a yes and no, a student did this or a student didn't. And you could adhere to that 2-level checklist and still make it work within the ExamSoft system. But what we decided to do is to modify that to more of a 3-level, so that it was yes partially and no, so that it seemed like it was expanded rather than just a yes or no. But if you would want to adhere to a basic checklist style, you can still fit that within ExamSoft and make it a 1 and a 0 as far as the point structure, or 2 and 1, however you would decide to design that. So you can make that fit within the system as well.
Thank you. Okay, we have another question here. Are you using peer-to-peer student rubric assessments? If so, what has your experience been?
At the moment, we're not using that. We did use it one time in our OMM course, and students sat together and reviewed actually a video of a practical assessment, assessed each other, but only completed one rubric. I know that might sound a little bit weird, but we had them complete one rubric only and come to an agreement on an assessment rather than using the actual peer rubric piece within ExamSoft. So that portion I can't comment on, and we actually haven't used it since that one trial run that we did. It went well, But as a learning exercise, we decided that it actually wouldn't be repeated, and that was a faculty decision. And now we just do the self-assessment component.
Okay, thank you. The next question we have here is, do record student encounters with SPs and then have the graders review these recordings to assess student performance, or are the encounters observed live by the graders?
The encounter, there are two different things that we have with our standardized patients. We have our simulations and we have our OSCEs. And they're a little bit different in that in the simulations, the students are assessed only by our standardized patients. And in the OSCE setting, the students are assessed by the standardized patient as well as the faculty member. In both of those cases, it's a live viewing from our faculty graders and from our standardized patients. The only piece of our assessments at the practical level that are not live are the self-assessments. Our lab practicals are also live assessments. So they're occurring in real time, and the faculty graders are there with a laptop or an iPad assessing the students and completing the rubrics in real time.
Thank you. Our next question is, how do you provide the feedback to students? Do you push out the individual assessment reports, or do faculty provide an overall summary that ties the results together?
We used to provide a summary, and we have now moved to students getting their individual feedback. So students used to see at a very high level just a summary of what they did well, what they didn't do well, based on their SOAP note and their encounter with the patient. Students now see all of their elements. The only thing they don't see is specific information in the rubric related to clinical diagnosis, because if we would ever want to use this rubric again, we don't want them to share anything with other students who are coming in next after them. So we do share it with them, but we leave that component very basic, and just within that rubric dimension, it just speaks to how they treated the patient, how they assessed the patient related to clinical diagnosis. It doesn't necessarily, actually at all, it doesn't mention the specific diagnosis, because that they don't want to give away.
Okay, thank you. And then the next question we have here, are all criteria equally important, or is one variable stronger than the other?
It varies based on assessment. In most of our assessments, there are what our faculty like to call, you either get it or you don't. Basically, if there's one component of it that you need to know in order to pass, that becomes a very highly weighted area within the rubric. So we do use the weighting on all of our assessments. The only exception to that is the checklist that the standardized patient uses. In that case, since it's basically a 0, 1, 2, those all have equal weight as far as points. But in most of our practical assessments, there are areas in which some of them have a higher weight and some of them are weighted lower. For example, hand washing is always something that is weighted much higher than the rest, because our faculty think that's very important in patient encounters to be something that must always happen. And there are other examples, but that's just one example of something that's weighted fairly high in comparison to the other elements.
We have another question here asking about how long you've been using ExamSoft.
We opened in 2013 in the fall, so we have been using it for a little over 2 years now for written, and then also when the rubrics came available, we started using that right away as well.
Thank you. And then we just have a few more questions here, so if anybody has any more questions, feel free to still put them into the question box and we'll get to them. So are rubrics field tested before they are rolled out?
Do you mean by our faculty, or I'll try to answer that question as I'm understanding it. They are reviewed by our groups of faculty within, let's say, the Intro to Clinical Medicine courses. There's a group of faculty that actually review that together and vet it. But if the question is regarding if they are tested actually in the field before we implement them here as an assessment in order to validate that rubric, we are not currently doing that. But they are vetted by our faculty who have used similar rubrics before in different assessment settings, and they have shown to be valid in the education environment.
Awesome, thank you. So looks like we have one last question in here. How many faculty does it take to do an assessment of a whole class, and how long does it take to assess a whole class of students?
For our practical assessments, the typical structure, so this applies to our OSCEs, our simulations, and our lab practicals. Our small groups are a little bit different because students are evaluated over the course of time based on several interactions. But as far as the lab practicals, the OSCE, and the simulations, we typically run each of those on a 3-day cycle. And it's only the afternoons of those given 3 days, and in some cases we haven't needed the 3rd day, but we always plan to have 3 afternoons in a given week, and students are given those dates in advance, and then they are told based on their groupings which day they will actually come in for that assessment. So it is rather time consuming. As far as the number of faculty that it takes, usually in our lab practicals, we have 6 faculty members because of the nature of how that's set up in the lab. Now for the OSCEs and the simulations, that's typically 4 or 5 faculty members that are required to be there for that afternoon. And for those, we do sometimes have clinical partners come in and serve as evaluators as well. We've used residents for that purpose in the past, as well as some other clinical partners, so students can then get used to what it's like to be evaluated from a little bit of a different perspective. And then those clinical partners, of course, still have a faculty grader assigned with them, but that then releases a little bit of the requirements of faculty time. So we've tried to be creative about how to make that work as well, and that time commitment.
Thank you. I think this next question, oh no, we have a bunch more questions that just came through. So I think this one kind of goes along with that other one. So can you describe the infrastructure, support, and personnel that you have to support the faculty in the assessment process?
Yes. So our team includes the 2 of us that you're hearing from today. So Assistant Dean of Educational Development, Director of Assessment. We also have a Coordinator of Examinations that's wonderful and supports these efforts as well. So the 3 of us are sort of the assessment team, and we work with faculty to plan these assessments, to run the assessments for the data analysis, and then the reporting on the back end post-assessment, and then the aggregation of all the data and reporting that faculty receive over the course of their course, whether it be a few weeks or over the course of a semester. So really the 3 of us work closely with faculty. We have a team of 3.
Thank you. So we have, it looks like there's just 2 questions left in the question box right now. How do you ensure faculty are available for grading, and are there problems with having to find substitutes?
Yes, that is certainly a challenge. One strategy that we use to make sure faculty are available for grading is at the beginning of every semester, one of the administrative assistants for our clinical faculty will block out every assessment date for the course of the semester, and in some cases the course of the year, so that we can ensure that faculty hold that as a time commitment on their calendars. They all have clinical days, and sometimes that's a challenge if they're out in clinic, but if they know about it in advance, they can easily find a substitute. So that's one strategy that has actually worked really well for us. We also have a pre-exam meeting 1 week before each of these practical assessments. So we meet with all faculty that are involved in any assessment 1 or sometimes 2 weeks before that assessment to make sure the rubrics are developed, that we have the technology that we need, all the logistics that will be needed to offer one of these practical assessments. We meet as a group and make sure that all of that is accomplished in advance.
Thank you. It looks like we have the last question right here. Do you train the clinical partners in the use of the rubrics?
Yes, that is definitely a huge opportunity for faculty development. We have ExamSoft training dates that we have at the beginning of each semester. And then for these practical assessments, if we have clinical partners coming in, we actually have pre-OSCE meetings to discuss cases, to discuss the design of the rubric, to talk about assessment, etc., to make sure that they're familiar with how we assess here, and then we can answer any question from an assessment standpoint that they might have before the assessment actually runs. So there is a lot of faculty development, both for our internal faculty as well as external partners, that has to occur.
All right, thank you very much, Dr. Jimenez and Dr. Zahl, for your time today. This will conclude today's webinar, and remember that at the end of this webinar that a pop-up survey will come up, and we encourage everyone to fill this short survey out if possible. This allows us to provide relevant content to all of our presenters, or for all of our presentations. Also, if you're interested in viewing some of our past webinars, you can do that at our website, learn.examsoft.com/resources. Thank you very much for everybody's time. It was a very good webinar, and I enjoyed everybody coming out today to learn more about Dr. Jimenez and Dr. Zahl. And thank you very much, everyone. I appreciate your time.
Thank you.